Professor Karen Lawford is here to weigh in on these Indigenous inequities in Canada. Thank you so much, Professor Lawford, for joining us again.
Thank you.
It feels like there has been more attention on issues of inequity toward Indigenous peoples than there has been in the past, especially in the media. Is this true, and why?
I think it's true. I think there's more attention because the pandemic has laid bare the glaring inequities between Indigenous and non-Indigenous peoples.
The heated relationship between First Nations and the RCMP is also historical, and we're seeing that again. We saw Commissioner Brenda Lucki deny systemic racism, and then the report revealing the issues of racism as well. What needs to change when it comes to the way the organization reacts, and I'm talking about the RCMP, reacts to these systemic issues?
I think it's going to be impossible to make any changes of any systemic value to not just Indigenous peoples, but to all peoples who reside in this country if there's not even an admission, an acknowledgement of the systemic racism that the RCMP uphold. I'm very concerned about the unwillingness of the head of the RCMP or a spokesman for the RCMP to actually admit that there's such a thing as systemic racism.
And we look at the relationship between the RCMP and First Nations because that's why the RCMP was created as a policing system for this group of people. So there is so much tension and so much history there that, I've talked to so many people, including yourself, that says both sides need to come to the table. What does that look like?
I think it's so much easier to say that both sides come to the table, but there's a substantial power imbalance
Mm.
between the RCMP and Indigenous people, First Nations particularly. So I think that there needs to be some internal work done with the RCMP. They need to come to terms with the significant amounts of harms that they've done to First Nations and all Indigenous peoples.
All right, let's pivot to healthcare, which is another area in our country where inequality is highlighted. A recent report in BC revealed that over 1,000 complaints made by Indigenous patients on how they were treated. Why are there so many times often, the singled out of Indigenous people when it comes to getting quality healthcare in our country?
Well, the healthcare systems in this country are all underpinned by a Euro Canadian biomedical model that's founded and grounded in white supremacy and eugenics. I don't understand how we could expect anything else. And I think that we're seeing a lot more complaints by Indigenous peoples because there's the capacity, like the technology to make complaints. I really don't think that it's any different than the way it was yesterday, and it's not going to be any different today if the healthcare systems and those people within it are not willing to come to terms with the white supremacy that exists within the biomedical model that is practiced within this country, and not just practiced, but also taught.
What does that mean, the white supremacy of the healthcare system? Kind of delve into that a little bit more. What does that look like for Indigenous people and just people of color when you say that?
It means that we have healthcare leaders who say there's no such thing as structural racism or systemic racism. They don't see anything but a generic body that is able to be treated the same, regardless of their experiences within a world, a Western world that relies on the marginalizations of people for its economic benefits. So the healthcare that you would receive is different than the healthcare I would receive simply because I'm white passing and you're a Black woman. I think that we might be coming to a time where people are going to start recording every interaction they have with a healthcare provider because people don't believe that such racism can exist unless it's recorded. And that's really frightening to me that we're not believing people when the harms are being done. And this is what I think of when I think of systemic racism. It is across all professions. It's not just physicians, it's not just nurses, it's also midwives, it's orderlies, it's everyone that works in that system upholds a certain hierarchy of being. And of course, the being that's the best human being is the white man.
Mm. Wow. Well, what a way to start to end that discussion. We are out of time already, but you're right. I mean, there's a lot of advocacy work that needs to happen in order for both of us to be able to get clear representation in healthcare and so many other areas of our society. Thank you again, always, for a rich conversation, Professor Karen Lawford.